All right. Hi, everyone. Welcome to Mapping Urban AI. My name is Sarah Popelka, and I'm a contributor and advisor at Urban AI. I want to thank you all so much for joining us for the second episode of this webinar series. The series is co-hosted by Urban AI, a Paris-based think tank dedicated to the emerging field of urban artificial intelligence, CIDOB, a Barcelona-based international affairs research center that analyzes governance dynamics at the local scale, and the Global Observatory of Urban Artificial Intelligence, which is an international city network association committed to technological sovereignty and the promotion of digital rights. The series was inspired both by the project, The Atlas of Urban AI, which is an interactive online map of AI initiatives that cities throughout the world have undertaken. And it was also inspired by our newly released Urban AI Guide, which presents detailed case studies of AI project implementation in local governments around the world. In this webinar series, we've invited 5 of the municipalities featured in the Atlas of Urban AI to dive a little deeper into their projects. This week, we have the pleasure of welcoming Jorge Aguado from the City of Buenos Aires. Jorge will spend 20 minutes sharing about projects that utilize AI for public health monitoring. Following his presentation, I'll open up the floor for a general question and answer period with the audience. Thank you so much for joining us today, Jorge. The floor is yours if you want to go ahead and share your screen.
Perfect. Thank you, Sarah, and hello to everybody. Thank you for being here to hear at least what we have been doing in Buenos Aires in these last years. Just to give you a brief introduction of myself and what is my relationship to AI. I used to be from 2015 to 2019 the Vice Minister of Science and Technology of Argentina, and I used to run the national plan of AI. And once I went out of the national government, I went into the City of Buenos Aires as the technological ambassador. It was it's a new post that is totally new, in which the idea is to handle and be the bridge between the technological ecosystem within the country and the region and globally with the government of the City of Buenos Aires. So within that, we've been working in different strategic plans in order to think of a future city. And in that sense, there was one area that we thought that the City of Buenos Aires has a lot of assets in order to take it from there, and it was a plan for AI. So saying that, let me share my screen. This is what I was mentioning to you, and just to give you a brief framework of how it was. The artificial intelligence plan we developed during 2021 and started in 2022. It was a plan that has a conceptual framework of different challenges and different lines of intervention that we need to tackle. And sorry, maybe within the presentation you will see some slides in Spanish and some slides in English, but I will go through them, all of them. So within this plan of artificial intelligence, there was 2 main challenges we want to tackle. The first one was creating the technology. The second one was implementing it. And the third one was in order to enable the technology within the whole framework of the city. So within the first challenge, our idea was to generate the conditions in which artificial intelligence would be developed in the city. So in that sense, we had a plan of human resources and talent, also a plan for data, another one for the infrastructure needed in order to handle all the artificial intelligence that wanted to be developed, and also a plan for research and development and the way we can handle new researchers in AI and new hypotheses and new develops over there. Within the second challenge of implementing AI, the idea was to see what would be the benefits of using AI for the citizens, not only in the sector public, but also in the private sector, and also the way implementation of AI would impact in work. So in that sense, we have been handling different stuff of areas of work. And what I want to be talking later, it's within the area of AI implementation within the public sector. But the last challenge of enabling the tools that would secure the sustainability of the plan within the city, it was about working on ethics and all the social implications of implementing AI, about how to handle all the bridges between the city of Buenos Aires and the ecosystem as a whole. Also, how to make a good linkage internationally. And the last one, the way we communicate the whole plan to all the citizens, knowing that many of the people living in the city of Buenos Aires would not know what is AI, would not know the way it could impact. And for sure, they will have much more fear about the implementation of AI than what they see it could benefit them. So that was a huge part of the plan also. So getting into the way we implemented AI within the public sector, there wasn't a strategy that we wanted to make that was having an open process in order to prototype different projects of AI. We call it Buenos Aires Exponential. And we did that one. In the end, I'm going to be talking to you about Cardio AI. That was the last implementation that it was really a success for us. So how was it Buenos Aires Exponential? So the process of Buenos Aires Exponential, it was a process in which every ministry with their teams would apply with different ideas of different AI projects that they will see it would impact and would benefit them within their processes or within the impact on the citizenship. Once they apply, there was a team within the Secretary of Innovation of the city that would make a first selection of them, in which we will left only 12 ideas. With those 12 ideas, we will get into a process of a strategic design, or what would it be, the project itself. After that, we had a second selection, also with the Secretary of Innovation of the city, but also putting together different companies and academia and different stakeholders of the AI ecosystem of the city in order to make that second selection and evaluation of the projects, and just left 6 ideas that they will have to go through a process that is very, very fast of 2 months in order to make a first prototype. With that first prototype, then we will do a final evaluation in order to have a final report and actually have what we call a process in which to see if there's feasibility from a technical point of view, but also from a budget point of view in order to scale it up and implement it as a whole in the city of Buenos Aires. So this is a process that we have done already 3 times. And within each process, we have worked in 2 ideas that went through this funnel. And with them, we were able, in order to put much more emphasis on the projects that would be good and would be scalable, and not lose budget within ideas that would never end up in a good situation. So the first project I would like to show you, and in order to show you that in both ways we work with projects in health, but with one we end up in a way that we were able to scale it up, and in another one not. That situation is with AI tools, that is COF for us. What was that we were trying to do? This idea came up during 2022, actually in 2021, but we did it in 2022, about if we were going to be able, in order to make a classification of COF and see if we can evaluate people from a COVID-19 point of view, compare it to the standard test of the diagnosis of COVID-19. So in that sense, we wanted to see if there was enough sensitivity and specificity of a machine learning algorithm within that, so as to work on that and put it into the process of diagnosing people out of COVID. So for that, we started using and taking as a tool what we call Boti, that is our WhatsApp chat that we use for every process within the city, and also with recognition of cough that we used to work with in that moment. And the convergence of both was IATOS. That was actually the project that we prototyped, and we wanted to see if it could go further. So during that prototype phase, we had a timeline in which we had to make at first a health protocol. This was a clinical research in order for us to be able that if it was good, all the doctors and all the hospitals of the City of Buenos Aires would like to use it. So we started making a health protocol. After that, we had to make a normal test for all the people that would be part of this prototype, to fill up a form to record the cough, and then we will work with that in a classification of that of that cough, and also to work within the neural network in order to see how it goes. And the idea behind all these was actually, if we would able to scale it up, to work in a way that within every people that want to go into the process of the triage for COVID-19, to get into our WhatsApp chat, do our triage. If you get it just because of the way the triage was, if you had a fever in that moment or whatever, you go just simply to the doctor triage. But if you were negative within that triage, we will ask you to record your cough, and we will scan it through our neural analysis and see if it wasn't good, the first triage, and send you also to a doctor triage in order to have new people with a COVID-19 positive case, and also to see, and this was within the strategy of getting all the near contacts of the positive COVID-19 people in order to get more contacts and start to have a better situation within the city, taking them into internation on isolation in the moment that what we have at the city. So for this, we work with a data set of almost 6,000 audios, in which we have half of them that was people with positive COVID test, and 50% negative. And what we end up finding, well, actually, this is the way the data set was. We had almost 3,000 individuals, but also you have the difference of ages of all of them. We had to work in a way that to handle all that pipeline of audios, we had to make a batch of pre-processing, then to process the signal, just taking in consideration the part of the audio that was only the cough, to make the training of the algorithm, and then to see the results, to see if we had to retrain again, or to see if it was positive or negative, and what was with the normal test, if it was the same or not. And with all that, we had a resultant model of 80% of all those audios were used in order to be trained, to train the algorithm. 10% of the audios, we use it to validate everything, and 10% of the audios we use to test, to make an internal test in order to make a retrain of the machine learning algorithm. So we had a huge precision on that, but beside that, we had a moment in which the negative validation precision was high also. So in that sense, we decided with the medical team in order to not scale it up and don't use it within the process. For us, and this is actually really, really great for the city, in a sense that if we weren't in the moment that we were doing that final in order to make prototypes and to make a final report, for sure we would have done a totally implemented full-scale project. So we would have used a lot of resources from the city, from people, time, and also money. So in that sense, the BA exponential process was really good in order to see if we will scale it up or not. Nevertheless, we use all that process in order to put all the information that we gather within those months. We also make a lot of collaborations with the Harvard University and MIT that they were working at that moment with cough records audios too. And we put all the information totally open, and not only the data sets, but also all the machine learning algorithm that we have done. So for everyone to use it and see if they would go through with this again. So let me get now into Cardio AI. So Cardio AI is another project that went into the funnel of BA Exponential, in which the idea of it was to develop a prototype of an extraction and mapping system that could go against the SNOMED CT, that is the standard process in order to find the data for health, in order to see all the risk factors of cardiovascular events. The idea was to get from the free text field that we had in our electronic clinical records that the doctors use within the health system of the City of Buenos Aires, to get out of there and see if we can put a standardized definition of a cardiovascular disease. So our hypothesis was that it was possible to train a natural language processing model in order to learn how to recreate and make labels to the different risk for cardiovascular things. Our idea in this was not only to help on the process for the doctors to handle much more faster the clinical records, but for the administration level, for the Ministry of Health, in order to start making predictive actions of how many people within the city will have cardiovascular risks, and start to work in a more preventive way than just reactive. So for this, the prototype had a characteristics of working with a model of AI of Amazon Comprehend. We had a data set of almost 500 electronic health records that were totally I don't get the word, sorry, but it's just putting out their names. and a time work of 7 weeks in order to have the prototype done. Within that, we had some results that were really good. We had an accuracy level of almost 84%, and we have a label detection that would go 2x, between 2x and 9x higher than what the health professionals would do. So we end up having clinical health records with much more information that would normally have. The not very good things was that the model requires a lot of text, analog text, in order to be trained, and also that we had a limited parameter setting in order to work in that sense. But nevertheless, we were able to handle the whole prototype process. So what was the comparison in the end between the medical doctor and the machine learning process? It was that when the model was completed, we had made a test out of 25,000 clinical records. And in that sense, we end up finding that the AI model would tag very fast, and the professional would end up trusting in the AI process a lot. In the end, we end up having, for those clinical risks like hypertension, diabetes, heart attack, and tabacism, we had much more, we had an incremental detection of those risks, of those numbers that you see on the column on the right. So to scale it up, and this is something that we are working now, we defined 2 phases of work. One, in order to implement the train model within the whole primary health system of the city. We have there 45 different primary health stations within the city of Buenos Aires, and then we have 11 hospitals. And that is something that we have been working from last year up to next quarter of this year. And then we are working also in a phase 2 in order to extend this model to other critical pathologies that we are seeing in the city of Buenos Aires. So phase 1, this is what we are doing that I was mentioning to you. And the phase 2, the extension, the idea is to see if we can get into and improve decision-making in clinical patients' care for the whole public health management. So in the end, what we will have next quarter in the city of Buenos Aires is changing from the actual process that is actually that a neighbor goes into a primary health hospital to get the appointment with the doctor, to have the doctor see what he has and writing down in the clinical record what it is. And for sure, that would end up being a standard label that we can hire within SNOMED, with a process that will have all that part going through the AI model. And on one hand, having that and information for all the doctors to have it, and in the end, had a better relationship with his patient. You have to know that within the city, you don't get, every time you go to the doctor, maybe you don't see always the same doctor. So to have a good clinical record for us is very important. But also from the point of view of the administrations, we will have much more information in order to take all those decisions based on prospective and retrospective evidence. So those are all the benefits that we are hoping to get within this next quarter, and this is where we are. So thank you very much. I think I'm within the 20 minutes that I had, open to questions.
That was perfect. Thank you so much, Jorge. Such an interesting presentation, and it's really so impressive what you guys have been able to do in terms of those kinds of diagnostics. I see there are some questions coming into the chat. If anyone has questions, feel free to put them into the chat, or you can raise your hand. Ernest, I see your hand is raised, so maybe we can start with you. If you want to come off mute.
Oh, sorry, Sarah. That was more of a applause, a little clap.
Oh, gotcha. Sorry, I thought you had a question. Apologies. Okay. Hubert, I see you have some questions in the chat. I'm going to ask one maybe before we get to the chat questions, because I'm quite curious. The BA exponential kind of program seems really unique for municipalities. I feel like it's less common for there to be this kind of like iterative design process where cities are just seeing what's possible and what can happen. And I'm wondering from a funding perspective and then also a capacity perspective, how you were able to achieve that kind of a program.
Yeah, so actually the idea in order to do BA exponential was knowing that we don't have huge resources. So the normal process of when you start in the end of the year, that you start to make your plan for the next one in order to make also your budgeting. The Secretary of Innovation that handles the whole technology area of the City of Buenos Aires has a lot of projects coming from all the ministries. So for sure, if a ministry end up selling an idea and having the budget, you end up doing all the projects that you get. And for that, for us, it wasn't the clever thing, because many of the projects and much more when you are talking about doing implementations of AI, you actually don't know if that's going to work or not. And there's a lot of things that for sure with AI, you can do better things, but in many processes, doing AI won't change a lot what you're doing. So sometimes it's like, you don't need to implement an AI process. It's really good what you're doing. Maybe you can do another stuff, or maybe that is not AI. So doing that process of prototyping and doing a feasibility study from a technical point of view and a budgeting point of view for us was critical in order to use all the resources that we have for AI and emerging technologies, that it is impossible to work on everything. So imagine that we have a team that has AI specialists of 12 people. So it's impossible to work with many things. So that process for us was a clever thing to do. Also, we end up finding that within the funnel of the process of BA Exponential, we put together all the different stakeholders. So we invite AI companies and we invite the AI academia in order to work with us in that process. So there are two things that for us are really important in order to evaluate the things and select the projects that we can do. That one is that it has to be a project that for sure is AI, and for sure it's going beyond what is known. If you bring an idea in order to do something that it was already done, for us is okay, just simply implement it. We don't need to do a full process of okay, this is going to be possible or not. So in that sense, if it's something that it has been done before, let's just simply make a public bid. Let's hire someone to do it, and that's it. If it's something that is totally emerging or if state of the art, okay, let's do it. So within that process, we actually don't use a lot of resources. So it's a really fast process in which from day one, when they applied, up to we have the final report, it's a 6 months process. Actually, it's a 5-month process. So we have 2 batches per year. So in that sense, is the way we handle it. And within the whole process, we didn't use a lot of resources in order to do coding. It's actually in order to make a proof of concept. So that is what we do. So let me just simply to give you another example of the way we handle and what we can get out of it. There was another project that we tried that we call it the eye of the city. So it was working with the tracks of the sanitation tracks of the city to put cameras on it and to start seeing while they were going through the whole city what was happening with the post lights, the streets, everything within the public space, to see if we have to send someone to do some work or not, if it's okay. So we end up actually working with Mobileye and Intel in order to use their cameras and to use their algorithms. And the idea was to actually implement that on every sanitation track of the city in order to have a prospective project for the ministry that has to handle the whole public space. After the whole process, we end up seeing that because of the way the tracks were, it was almost impossible in order to have a good definition of what is needed within the streets and within the poles because of the length of the tracks and the cameras. It was a pity for us because it was a really nice project to do, but definitely it allowed us to don't spend a lot of money implementing something that it would work in the end. And that is what is magic for us in the sense of working with AI in new things that you don't know what would come in the end. And there are one more thing that I want to add to that is that if you have seen on the first slide that I show you of the framework of the AI plan, so we end up we have an area in order to work with ethics. That for us is really, really important. So we end up making an ethics committee of people that it's not from the city. There are no public officers, and we'll work with the projects that end up going out of the BI exponential plan in order to see that within that project there are some ethics considerations that need to be handled. So that for us is really important, that once we want to scale it up, we know the things that we need to take really care of it. And within that, the last part of it is that we end up putting law that is a sandbox law. So we have also a regulation in which we can try new things that are not allowed by a law in a totally controlled area. So in that sense, we have everything in order to have that funnel very well and to handle it very well, so as to end up implementing things that would go through.
That's fantastic. Thank you for taking us through all of those different elements that helped you build the program and have it be so successful. That's something we kind of noticed with doing the Urban AI Guide as well, is most of the successful AI projects just started out as those proof of concepts, because that's the easiest way to get buy-in. Let's see. So you mentioned, Hubert asked a question about the timeline. You mentioned that the overall timeline is around 6 months for BA Exponential.
Yeah.
But what's the timeline for each of the steps in the process?
To each of?
Each of the steps in the process.
Okay. So for the first part of the application is actually, we give them a month once we open the application process. After that, we have 1 week for selection. Then is the part in which every team has to make the strategic design of every project. That is another month. Then we get another week for the second selection, and then is a process of 2.5 months in order to make the prototype, with also having someone else from the ecosystem working with that team. And the last 2 weeks of the process is the final report in order to make the evaluation to see if we scale it up or not.
Thank you. A new question just came in that's kind of a combination of another question, so I'm just gonna group them together. That it's kind of 2 parts. So one part is, how do you involve citizens in the community in the process? And then what are some of the main challenges that you've faced, and how did you address those challenges?
Mm-hmm. So for sure, AI so far, it's something that everybody talks about, but not many people understands really what is and what are the whole benefits of it and the potential of it. So definitely in all these processes, we use a lot of resources also in order to train and make facilitation for the people of all the ministries in order to know what they can do. We end up receiving a lot of projects that they're not AI. Many of those are, I don't know, chatbots or things that definitely you can do something else. So far it's really hard in order to get really good projects to work with. So there's a lot of interaction between the people that knows about AI and the people that knows about every vertical business of the City of Buenos Aires, and that takes long. So for sure, there are a lot of challenges within a city. Every ministry has huge challenges, and for sure there's a lot of room in order to operate with AI. But there's a lot of emphasis on working together with the team that knows every area and the teams that know AI, in order for them to end up making one team that could develop a really good project of AI. If you want, and you have seen here that we have worked in 2 health projects. that I think is definitely the pandemic ended up making that the technical team of the innovation secretary and the people and the technical team of the Ministry of Health, they have worked together really hard during 2 years. So they know each other, and everybody knows the way they work the other way. So that helps a lot. But that was something that was done because of the pandemic, and it was a really extreme situation. But it's really hard in order to do it with all the ministries of the city. So that is something that takes long. So I think that that's the main part of the whole projects in order to get really good projects and to work with. For sure, there's another situation within the Ministry for Security that is something that goes. There are a lot of projects all around the globe, and that is something that there's a lot of room in order to make comparisons and make studies in order to see what you can do and everything. But that is another whole area. How to involve community. So for us, the process of making a prototype and making the feasibility process, it's a process in which we don't put community into. It's a really short process that if we want to put the community into, it's going to be really hard in order to get to what we want in the end. But that is why we have this ethical committee, in order to see if there's something that we need to take care of, taking in consideration what the implementation would do for the citizens. So once we have all that and we end up saying, okay, we need to scale it up, that is when we put into the citizens and the community in the process of it. Most of the things within the city has open processes in which we put together the community in a virtual way, in a presential way, with events that we show what we're doing, and they would say what they think of. So it's a city. Buenos Aires is a city that has a lot of those processes going on for everything that we do, not only in technology. So actually in technology is the ones that we need to do it more, because definitely what you see when you do, and that is why we do the sandbox process and the sandbox law. Definitely you want to boost and help innovation to go forward. And you want also to have a really competitive ecosystem for technology companies and the academia in order to work on new things. But on the other side, you have the third part, the citizens, that are the most vulnerable in these three triangle. So we as the government need to also handle that, and that is why we try to test everything before we implement it, and we really will implement it if we know that the benefits are much more or are higher than the risk of implementing something.
Thank you. That's great. Also really good to hear about the ethical committee. That seems like a nice way to think about the citizens. There's another question in the chat that's a bit related to that, which is asking about overcoming the barrier of data privacy related to patients' health data. So you mentioned the anonymization of the data. Are there any other tools that you use to ensure patient privacy? And then another thing that I was wondering as well is how do you kind of encourage participation for people to share their data with you?
Mm-hmm. So if you want, there were two parts of it. The first part was while we were doing the prototyping. So we used recorded data. So for that, we do the anonymization of the data. Now I could make the word. But then once we will scale it up. So we have a process in which every citizen of the city that goes to the public health system actually needs to sign up that he will have all his information of our clinical record system. So that is part of the normal process of it. And then what you have to know is that every database of the City of Buenos Aires, it has public responsibilities and social responsibilities for the public officers that handle those areas. So everybody needs to sign that is the one that is responsible for that database. That is part of the Ministry of Health and part of the team that handles the whole data centers of the City of Buenos Aires. And that is something that is totally into the legal system also. So we present everything that we have in those databases to the judicial system, and everything there is handled that. So every public officer that signs that he's responsible for those databases really takes care of it.
There was another question in the chat about some of the other use cases that you guys are working on. So maybe things that are not related to health, if you could just share a couple of examples.
Well, I tell you about the one of the eye of the city. That was one project within the whole process. And there was another one that is actually now in being prototype, that is part of what we have been doing with the, I don't think I have the word, but all the rest of the area, the area of the city that we can make buildings within there. So there was a huge work in order to digitalize the whole the rules and regulations of the city in order to make buildings, to digitalize all that. So we have now an intelligent map in which everyone that is a building construction company can get into there and can see how many cubic meters he can work in different parts of the city, and it handles very well, and it makes much more faster the process in which every construction company within the city can find a place where they can make their own project. So that was a really good project that now is totally implemented.
Do you have any mandates around making the code and data, at least the data that's not sensitive, publicly available? Or is that not really a priority of the program?
So within the framework of the AI plan, we're working a lot in order to see what are the data sets that we can put totally open and anonymize in order for the private sector of the academy could work with that and work their own projects. So the City of Buenos Aires has been working to be an open government since 2012. So there are a lot of years so far that we are putting out data sets of information of the city out there for everyone to work with. So that is something that keeps going on. Yeah, that is a policy. Definitely, there are a few things that every time you get into a new data set or new things that you can work with, there is an area that it's an undersecretary of data that manage everything and works on the databases that can be open to the public.
Marta, I see you put a question in the chat about taking into consideration ethical principles for the non-health projects.
Sorry, what is the question?
I guess, how do you take into consideration ethical principles for the non-health projects?
So for every project, what we have done, let me look for that. Just give me 1 second. We have done, actually, we end up making our own principles ethics, but it's pretty much the same of what the OECD has done and what UNESCO has done. So we have 8 principles, and within those we work in a sense that we see one by one. But anyway, we are working now on different tools in order to have that done. So on one side, we're working on a standardization form for every project manager within the city that wants to work in AI in order to start feeling what he wants to do. And then we're making them questions in order to see if they have thought about the implications of that project, and to see the way they're going to be handling the continuous process of how everything is going to be evaluated and controlled. Once we get there, we are making an evaluation of, well, actually we're not making, we want to make an evaluation of all those forms in order to see if there are some of the projects that we need to put within the ethical committee. And the ethical committee idea is to see the projects and actually start making all the risk that need to be handled and send it back to the team that is working on the project in order for them to see what they have to make an idea of how they're going to handle them, and to send it back to see if it's feasible for us or not.
Thank you. Also, I realized I misspoke. She was asking about all of the projects, but I think you answered for all of the projects, right? Like that's your general process.
Besides BA Exponential?
Oh, I think all of the projects within BA Exponential. Yeah. Sorry, I misspoke when I asked the question, but I think you answered the correct question. So we're good.
Okay.
Sorry. All right, last chance for questions, anyone? Feel free to come off mute if you'd like to just ask something. No takers? All right, well, thank you so much, Jorge, for that fantastic presentation. It was really, really amazing to learn about what you guys are doing at Buenos Aires and the BA Exponential program. And those are truly some very impressive projects that you're working on. Thank you also to the audience for coming out to this episode of Mapping Urban AI. Make sure to join us next week on March 21st at the same time. We'll have a representative from the UN Innovation Technology Accelerator for Cities talking about AI as a tool for enabling safe and inclusive cities in Africa. Yeah, thanks for coming out.
Thank you very much.
Thank you, everyone. Thanks a lot. Bye. Thanks, Jorge, for the presentation. It was really great.